Welcome to the Mini Medical School podcast, where we dive into the world of medicine. I'm your host, Kane, a first-year medical student, and my guest today is Dr. Nabha Shetty, Associate Professor in the Department of Internal Medicine at Dalhousie University. She recently presented at the Dalhousie Mini Medical School on the topic of medicine and planetary health. Thanks for joining us, Dr. Shetty. Can you tell our listeners a bit about yourself and your work as a physician?
Thanks, Kane, for having me. This is a wonderful opportunity for me to share a little bit about planetary health and about my own passion for the subject. So I'm a general internist, and I'm a big picture specialist, both within patient care, but also I really focus on the big picture of systems within healthcare. And planetary health and greenhouse gas reducing care became a focus for me professionally because it kind of trickled in from my personal passion for this subject matter. And that's what really drove me to get involved and bring that into my professional life as well. So I'm one of a few physicians who is leading some of the work in Nova Scotia Health in this area. And it was a real pleasure to be able to give Mini Med School presentation, which was public facing. That was my first public facing talk about the subject matter, actually.
Yeah, I thought your presentation was excellent. And you talked a lot about the climate. So how has the climate affected our health?
Well, I think that if you're listening in and you live in Nova Scotia, I think we've all been direct witness to how climate change is impacting the health of Nova Scotians. So last year we had, the greatest number of wildfires, and actually, I've lived in Nova Scotia now since the age of 9, and I was away for medical school and residency for a period of a few years. But since being in Nova Scotia, I'd never heard about a wildfire, and so last year was like a devastating year for wildfires. A lot of displacement of Nova Scotians, a lot of smoke-related lung injury. We saw a lot of homelessness and issues with housing and displacement related, and the health issues that come alongside that, situations of overcrowding, particularly during viral seasons. And now we don't really even have viral seasons, frankly, and that is also related to climate change globally, where you'll see that, when we used to have influenza for a few months a year and you got your flu shot and you're kind of good to go, that's no longer the case. And we're seeing flu pop up as early as September into as late as March, April, which is kind of unheard of until the last few years. And that's all because of a changing climate, changes in vector-borne disease, changes in kind of our ecosystems, and the changes in the wildlife's health as well. This is all related to climate change, and it's definitely directly impacting Nova Scotians. We also had flooding, which leads to a different type of displacement and different risks as well.
Yeah, you mentioned influenza. Is there any other infectious diseases that come to mind that are really starting to pop up that we traditionally would not see in Nova Scotia?
It's a good question. I'm not an infectious disease expert, but I certainly see a lot of infectious diseases coming through the acute care centers, and I work closely with infectious disease experts. I will say that Lyme disease, which has been known to affect Nova Scotians for a long time, but the prevalence of Lyme disease seems to be up, and we've had a lot more Lyme-related admissions than ever before in the past couple of years. And that does probably relate to, the vector transmission and tick-borne illness changing because the seasons that ticks are just around is changing, where it's warmer in the climate. The other thing that has also come up that we never really saw before was anaplasmosis, which is a co-infection often of the same ticks that carry Lyme. They carry anaplasma, and that has led to severe infections for a lot of patients who required hospitalization. And then there's another illness that was typically really found in the southern United States called babesiosis. This is another tick-borne illness that we were seeing cases of Nova Scotia a few years ago, which was kind of a new thing for us. And then, of course, we need to consider infectious diseases risks that come with population migration trends, immigration trends. And all of that does relate to climate change and planetary health, where we are going to be seeing more people coming from areas that are becoming less and less habitable. And so we'll see population migration. I think there's a projected 80 million or 800 million, actually, maybe refugees projected by 2050, climate refugees specifically. And Canada and Nova Scotia are going to be desirable locations because they're not already in a hot belt. And so we need to prepare for that, and our healthcare systems need to prepare for that.
Yeah, it's extremely unfortunate seeing refugees. Another big concern, a lot of people I know talk about microplastics. Do we consume a significant amount of this, and is it a concern?
I don't know the answer to that, Kane. I don't have a lot of knowledge when it comes to microplastics specifically. I know that on the personal side, I've really tried to reduce the plastic in my household, insofar as even looking at, what type of detergents I'm using to wash our clothes, because microplastics are basically found in everything manufactured, unless they specifically state that this is phthalate free and more of an environmentally friendly company that's producing whatever you're purchasing. You do wonder how much the existence of microplastic, like in our environments and in our bodies now, contributes to the healthcare issues that we're seeing, like rising rates of cancer and even heart disease. And I don't have a great answer for you because I don't know very much about microplastics, but it likely does play a role in the in our own health as well as the environmental health.
Yes. When we think about other aspects of healthcare, we also think about the emissions that happen there. Can you discuss what the most significant source of these emissions are in healthcare?
Well, in healthcare, the most significant source of emissions come from the supply chain. And so it's not so much the actual delivery of the healthcare that is causing emissions up front. It's all the emissions that go into production of the stuff that we use to provide healthcare. The drugs or medications, the plastic stuff that we draw blood with, that the energy and the emissions related to making an MRI machine, or there's just a lot of supply chain related. I think it's about 70% of admissions in healthcare delivery come from the supply chain. And so the way to address that and not feel just so helpless that you have no impact on procurement or how stuff is getting made, being a frontline healthcare worker, is to really think about whether we need to do something. So it's kind of like if you're going shopping and you buy something that's kind of wrapped in plastic or in a plastic container, and then you put it in the recycling. It might feel good that you're putting it in the recycling, but actually 90% of that, of the cost to the planet has already happened just from you triggering the supply chain by pulling it off the shelf. So the less we actually do in healthcare, the less we need produced in healthcare. So there is a direct impact of frontline decisions on the supply chain, and it comes from a place of doing less, which is often doing more, not just for the planet, but also for patients, because we're quite wasteful with our healthcare practice in Canada.
Yeah, that was really interesting that you talk about recycling is not as effective as someone would intuitively think.
No, it's not at all. Yeah.
Should we be advocating for more policy changes, or is this something we can do at a micro level?
Well, Kane, I think that the answer is both. There tends to be kind of a feeling of being overwhelmed if we only focus on macro policy change, because it does feel as though for the average person, for the majority of people, they have no control over policy. But micro changes done at the individual level make you feel like you're starting to make a difference. And these changes have ripple effects. We all have circles of influence. And when our circles of influence see changes in our own behavior, they start to change their behavior. And that starts to shift culture at a societal level. And that's what we really need for policy change, because policy comes from politics. And to change politics, we have to change the masses. But it happens with each individual starting themselves.
Yeah, I thought that's an excellent point. I know something I hear a lot from people is when they hear reports of celebrities using private airlines and their carbon footprint is significant, and when it compares to an individual, it can lead to burnout. Is there any way of appropriately looking at these scenarios and how one can think better about their practices?
Do you mean like from a you and I as an individual about how we can avoid burnout but still be thinking about how to mitigate our impact?
Yes, exactly.
Right. So I struggled with climate change anxiety for a long time and still do to an extent. And it's really what drove me to get involved more in this field. And I think it is a common struggle for many, many people, especially many people who are in their youth or just, just starting to understand the science behind it. Probably like teenage to people in their 20s. And then also what I'm seeing is it's really impacting the grandparent generation as well, because they're really concerned for their grandchildren. So I found the best way to manage anxiety around the changing climate was action. Action alleviates anxiety. And so that's why I started making small changes within my personal life and starting to leverage my circle of influence. Now, it's frustrating at first because you're doing all this stuff. You feel like you're the lone warrior kind of fighting this battle, this tsunami that you're standing up against. And everyone else around you just doesn't seem to care. And that actually creates a lot of conflict. It created a lot of conflict for me in my personal life with my husband and with my parents. And, I really was so geared towards getting to a zero waste household, and it was just impacting everything we were doing. You just have to recognize everyone's going to do their own bit in their own way at their own pace, and just starting conversations about it has influence. And that's what's kind of tempered me down, and recognizing that my personal influence is only going to do so much, but where now I've brought it into the professional sphere, that professional influence is actually going to be more impactful. And then as we start to shift culture within Nova Scotia Health itself, that is going to be hugely impactful. So it's a marathon, not a race. And it does feel overwhelming because it feels like we don't have time, like we should have started this 20, 30, 40, 50 years ago. But at the end of the day, all you can do is just keep going and focusing on the small wins, which end up actually being pretty big wins, because every small win is a collection that starts to shift culture.
So when we think about doctors' impact with their practices, should we be doing more telehealth? Is that something that really can save and reduce the carbon footprint?
Absolutely. And we have started shifting gears towards more virtual care since the pandemic for infectious control reasons, but it has a side benefit of being a far more environmentally friendly alternative when it's appropriate. So there's a study actually that came out of Toronto that looked at 850 or so virtual care visits and showed that it saved 850 metric tons of greenhouse gas emissions just because of saving patient travel. And there's the side benefit of also saving cost for patients, because they don't have to actually make their way into the centers to go see their doctor in person, if these issues can just be handled through virtual care just as easily, or preferably often. They also don't have to spend money looking for on parking, or drive around looking for space to park. Using public transport is often very onerous for patients to get into urban centers, which is often where our hospitals are located. They have to take time off work, which is a financial impact for them as well. So there's many, many benefits for virtual care, and the environmental impacts are one of them. But it's a great example of the triple win, where you have better care for patient, better system outcomes because it improves efficiency. You're not going to have no-show rates, et cetera, and it's better care for the planet.
Yeah, that sounds amazing. Increasing efficiency often aligns with improving the planet as well.
Yeah.
Is there any other technology that are emerging where you are optimistic about and you're looking forward to?
I'm going to say no. I think that actually emergence of technology needs to be taken with a grain of salt when it comes to planetary health. They've studied, like machine learning and AI, and its impact in medicine. And it's really carbon intensive. Machine learning and like artificial intelligence use a lot of energy and generate a lot of emissions. So what I'm actually more excited about is leveraging the power of humanity. We should not be replacing what humans can do with machines. We should be doing them as humans, and we should be relying a bit less on technology and more on our humanity and human interaction, more on clinical acumen, more on bedside care, rather than testing and trying and, technologizing everything. That's not really a word, but you know what I mean. So I think the way to get to a sustainable health ecosystem is actually leveraging our humanity and our human interactions.
Yeah, that definitely sounds interesting. There's always pros and cons to new emerging tech. Do you envision any further changes of the healthcare practices that you want to see more of?
Yes, absolutely. So I think that care that is focused on the big picture is what I want to see more of, because that's going to be care that benefits, that again achieves that triple aim. It benefits patients, it's better for systems, and it's going to be better for the planet. So we in Canada have, really globally, have swung our pendulum way too far over towards specialized care. And we need to bring things back to the power of generalism, which is where, primary care and other generalist type of care is going to thrive. And that's going to be our solution. Seeing people as whole people rather than just seeing one problem to fix in a certain way. Because at the end of the day, the care for Nova Scotians is really going to need to be frailty focused. While we have a lot of influx of new people coming in, the vast majority of our population are still elderly, and they're frail, and they don't benefit from a piecemeal approach to care. They benefit from a big picture approach that understands when interventions and high resource use is actually not going to benefit them and is actually going to deprive them of quality of life. And it does so in a very wasteful way to the planet as well. So I'm more interested in primary care empowerment, generalist empowerment, big picture medicine, which I think is coming down the pipelines more. There's a recognition of the importance now.
Yes, that's so important for empowerment. And when you put forth new initiatives, what are the common barriers that you encounter and how do you overcome them?
The common barrier is often priorities and resources. For example, I've been working on an initiative to reduce our use of metered dose inhalers that emit greenhouse gases in the hospital in Halifax, starting with the medical teaching unit. And we had a lot of support at the organizational level through Nova Scotia Health Quality, where our project was accepted in a quality team competition. Which kind of provided us with some support with how to design the project, how to develop a standard operating procedure, a framework for it, et cetera. And then when we were kind of ready to launch, we just didn't have anyone to do the work on the front line because everyone seems really stretched thin. And there are so many competing priorities that actually looking at the big picture for the planet and the system is the last thing on everyone's mind. So that is the biggest challenge. And the way that I have slowly been overcoming it is to kind of start spreading the message up the chain towards leadership. And also showing the co-benefits to the system leaders whose focus might not be on like saving a planet. It might be on, oh my gosh, like how do we balance all the demands of our healthcare system right now with the limited resources that we have. So showing co-benefits of how actually, you know what, green care saves money, green care saves lives in many ways, or saves, the quality of life in many ways. green care is better for patients, like showing those co-benefits up the chain to leadership gets more and more endorsement. And so it takes a long time, and you kind of have to be patient. And I'm not a patient person when it comes to wanting change to happen, but it's been a really great lesson in learning for me about how to adjust my expectations of an outcome and of the timeline of an outcome. And that's really what it is. It's a long game. So it's kind of chipping away at things and taking them up the chain until you get that sponsorship and buy-in from leadership who really make the decisions with resources.
Well, thank you for doing such important work. I think that's often a tough thing to do. What advice would you give to a student interested in pursuing a career of medicine?
I would give them the advice of learn as much about non-medical topics as possible before coming in, because I think a wealth of academic and life experience is going to be fuel for a fire, and we need all different types of approaches coming into medicine to start transforming our systems towards a healthy ecosystem. So I think there is a huge value to a breadth of experience that stretches well beyond sciences before pursuing a career in medicine.
Yeah, a diverse background is indeed very important. Thank you, Dr. Shetty, for your insightful discussion.
Thanks for having me, Kane. It's been a real pleasure.
And for the audience, thank you for joining us, and see you on the next one.